Number of West Nile virus cases is growing. Today, a mosquito trap sample collected at Lakewood Park in Leander tested positive for the virus. And that's just one of several traps that have tested positive this summer. This week, we learned there are now 2 people who've gotten sick from West Nile in central Texas. Here's KVUE's Fort Sanders.
There are now 9 human cases of West Nile virus across Texas as of Tuesday, July 23rd. Dr. Varun Shetty, the state's chief epidemiologist, says 3 of those cases include neurological symptoms.
Among those, 3 have had what we call neurologic illness or disease that is affecting our nervous system, our nerves, our brain.
West Nile virus comes from infected mosquitoes. Most of the time, those infected with the virus will have symptoms such as headache, fever, muscle and joint pain, nausea, and fatigue. Dr. Shetty says neurological symptoms are extremely rare.
And much more rarely in less than 1% of cases. And the types of symptoms we talk about are things more like neck stiffness, confusion, sometimes tremors or seizures, and then in the most extreme cases, even death.
Tuesday, Hays County officials announced that there is a confirmed human case in the county. However, although there seemed to be a higher level of neurological cases of West Nile, Dr. Shetty says it's too soon in the season to tell the severity of this year's strain of infection.
We haven't seen anything that would make us think that this form of, or whatever is circulating right now, is worse than in past years. But we know that there are a lot of mosquitoes out there right now.
And Dr. Shetty says there are important and easy ways to protect yourself from getting sick.
Wearing long sleeves, wearing pants to kind of create a barrier of protection to limit the chances for mosquitoes to bite you. Using insect repellent, like products that include DEET in them.
Reminding Austinites, these mosquitoes are attracted to pools of standing water, so be sure to keep your space clear and dry. In Austin, Fort Sanders, KVUE News.
Several cases of dengue fever have been identified here in the Austin area. That illness is spread by infected mosquitoes. Austin Public Health says the cases involve Travis County residents who traveled to different parts of the world, including Central and South America and Asia. At last check, there have been 10 cases statewide, and experts say about 5% of dengue fever cases can be severe and life-threatening.